I want to tell you about this dynamic duo of doctors. It's a mother and daughter team, Dr. Maggie Mujapilo Mokotedi and Dr. Malibo Mokotedi Mapiloko. They are healthcare professionals. They are doctors, both of them, in their own right. They say they are walking for all the fallen heroes who really gave up their lives trying to save ours in the fight against this thing. And I've got two guests this morning. I'll tell you about the second one in a moment, but Dr. Malibo is in the studio here with us. A very good morning and welcome to 702 Breakfast.
Good morning, Bongani. Thanks for having us.
You've got an incredible story. So your mother, Dr. Maggie, was a doctor, and you talk about growing up and just admiring this woman, going with her to Kalafong Hospital back in those days, and her example inspired you to become a doctor.
Absolutely. So my mother was one of 9 girls and 3 boys. And what really inspired me about her story is that in that era, becoming a doctor, especially as an African woman, was something that was not common. And her mother was a cleaner at Kalafong Hospital. But she said when she looked at the long lines and the level of care, she decided, I want to be a doctor so that I can change the trajectory for young people who want to become doctors, but also for the healthcare service delivery industry.
Oh, wow. That's incredible all on its own. So her mother, your grandmother,
yes,
was a cleaner at Kalafong.
Yes.
And your mom decided, I'm going to break the cycle. You grew up with that inspiration and you thought, well, I too need to do my bit.
Absolutely. Yes. She really, her and my grandmother were a source of inspiration for my decision to study medicine.
Now, one of the things you have done in working with your mother is you've come up with digital solutions in terms of streamlining healthcare and making access to information easier for patients. Tell us a little bit about that.
Yes, this is a very exciting project that my mother and I, together with my younger sister and younger cousin, embarked on. We've got a multidisciplinary medical center in Dainfern, state of the art. So we see patients physically, but we noticed that one of the gaps in the market was actually creating a digital platform which would improve access of care. For example, we've got a telemedicine platform where patients can consult with us remotely, particularly during COVID-19.
Yeah.
We've got remote patient monitoring. So for the patients who are at home, we've got equipment that can actually empower patients to be able to feed back vitals, necessary vitals, which will help us to make clinical decisions with the patients at home. So there are various other ICT type of technologies that we have embraced to improve access to healthcare and also to improve patient outcomes.
One of the things that's obviously been a great concern to you, no doubt, will be the colleagues, people you know who have succumbed to the virus on the front line. We're talking nurses, we're talking doctors and other healthcare providers who succumbed to the virus even as they were trying to fight for the rest of us. These are people obviously who could have chosen not to get involved, but did so anyway and paid the ultimate price.
Yes, so I think we all know that COVID-19 brought with it a myriad of challenges.
Yeah.
But as healthcare workers, we never envisaged that we'd see the avalanche of healthcare workers passing away from COVID-19. And I think, Bongani, it's from this premise that my mother, Dr. Maggie, decided to have an online memorial because she felt that we need to encapsulate the legacy of these fallen frontline heroes. And I must say, this is not the first of her memorials. She's a very active person. Many years ago, during the political violence in Thokoza, she founded the Thokoza Peace Memorial, where people from different parties came together, and she had all the names of the people who had passed on at that time. So what is exciting is that we, being digitally inclined, could found a digital memorial in which she collected the names of all the healthcare workers who've passed on and created a roll of honor where they are honored, where their legacy is remembered. But not only that, she actually is creating a platform where we can engage with the families of the frontline workers who've passed on and provide counseling and other types of post-trauma care for them.
And of course, part of the reason that makes makes so much sense and why it's obviously so personal for you is the story behind our second guest who joins us now in the studio as well. Nomsa Mnguni, good morning to you and welcome to the program.
Good morning, Bongani. Thank you so much.
I'm going to ask you just come a little closer to the microphone so we can hear you a little bit better. You're a living example of why this memorial is so important because you were studying and of course COVID struck you in a way that's really deep and personal. Tell us your story.
Good morning to all South African listeners. Thank you, Radio 702, for allowing me the platform to share my story. This is not only my story, but it's the story of thousands of other family members that could not be represented. My name is Nomsa Mnguni. I'm originally from Klerksdorp in the Northwest Province. So before lockdown was declared, I decided to catch a flight to Mhlanga in Durban.
Yeah.
And that's the flight which I regret catching in my life, although it was for work purposes. The national lockdown was declared, and at this time I knew that I was going to be embedded in KZN for quite some time. By then, my mother was working in the MDR or XDR unit in Klerksdorp, Tshepong Hospital to be exact. The ward was closed.
She was a nurse, wasn't she?
She was a professional nurse, yes.
Yeah.
The ward was closed as the hospital decided to turn it into a COVID ward due to lack of resources. I had a discussion with my mom as I was stressed and panicking. I read the news and I saw that people were dying like flies, which made me more anxious about my mother's safety.
Yeah.
I pleaded with her not to work in the COVID ward, but she told me that she had no choice. It was her calling, her pledge as a professional nurse, and she had to save people's lives. That she did quite successfully as she had 0 fatalities. At some point, she would even moonlight, as no one wanted to work in the COVID ward.
So she'd take on extra shifts.
Exactly. So please allow me towards the end of my story to share my mother's audio recording prior to contracting COVID.
I'll tell you what, Nomsa, you've obviously prepared your thoughts here, and I really appreciate that you've put them down. And depending on how time works out for us, we'll certainly play the audio that you've brought us of your mom, certainly before the end of the show. You were obviously concerned about all of this. What happened to your mom in the end?
So at this time, my mother started panicking and stressing. So she was mainly worried about the following reasons. Firstly, there was lack of PPE. Secondly, there wasn't water in the ward. And thirdly, there was lack of training, which is equivalent to incompetence. I strongly believe that the above-mentioned points contributed to my mother's death. So my mother was admitted in July together with my grandmother. They contracted COVID.
Yeah.
Yes, and then I'm so much emotional.
I know. I can see it. Look, it's okay. I think in the telling of your story, Nomsa, in the telling of your story, I think there are a lot of people who need to hear exactly what happens to all those unsung heroes whose names we haven't even heard about. So I know it's difficult for you to tell us your story, but I think it is an important one to be told.
Yes. So on the other hand, I had panic attacks, anxiety and depression. All I could do was to hope and pray that they're going to recover. Unfortunately, after 3 weeks, my grandmother passed away and I had to drive from Mhlanga to Klerksdorp. I also had to remain strong and hopeful for my mother's recovery. 2 weeks after my grandmother's death, my mother passed away. And I was able to see my mother twice in Life Ankron Hospital in Klerksdorp. I won't dwell much into this as it's very sensitive and emotional to me. So I had to plan, prepare, and execute the funeral all by myself.
Yeah. What was that like for you, Nomsa?
After my mother's funeral, I was left all by myself in my mother's house. I was extremely suicidal, and that's when I reached out to Healthcare Workers Heroes Memorial Funder, Dr. Maggie, and her daughter, Dr. Malebu. They opened their heart and home to me, and I've been with them since then. So we're working together on the Healthcare Workers Heroes Memorial. We're reaching out to young families who are going through a similar situation as mine.
Yeah.
Yes, the role has helped me in a sense that I'm no longer on antidepressants, because I used to be very suicidal. I wasn't coping at all.
Yeah.
Yes.
And I think that's the important thing to underscore, that Dr. Malebo, that it's not just about memorializing these names of these heroes, although obviously that's an important part of it. But also it's about making sure that the people they leave behind are taken care of. If not through financial means, certainly to be able to provide the kind of support they need when they go through tough times emotionally, right? Their loved ones gave up, they gave it their all. They made the ultimate sacrifice.
Precisely, Bongani. And I like what you're saying, that this Healthcare Heroes Memorial initially was based on creating a platform to showcase the number of frontline fighters who have passed away. But through this, we've actually had a number of family members who've reached out to us and said, we are going through a tough time. We're traumatized. Our mothers, our fathers have passed away. We need psychological care. And then we decided to open it up to create it into a very interactive platform where we can connect people, families that are traumatized, with the necessary, counseling and services required. But I think more than that, I think it's very therapeutic, Ebongani, particularly for frontline fighter colleagues as well. Myself, I also contracted COVID-19 at some point, and the strange thing is, at the peak of the pandemic, I was busy collecting names of those who've passed away, and as you can imagine, this was traumatic in itself. So I think this has created such a wonderful platform. It served as a catalyst, actually, because there are so many occupationally acquired illnesses that frontline fighters, doctors, nursing sisters, paramedics are exposed to. So if you look at our role of honor, it's not just limited to COVID-19.
Right.
90% of them are COVID-19 patients, frontline fighters, but a certain number of them are actually have actually passed away from TB, MDR TB. This most healthcare workers will attest to the fact that they know a lot of their colleagues who've contracted the bacteria, the TB, and who've passed away from it. Most recently, Bongani, it's last week, one of the most prestigious professors, Professor Wonga Machoba. He's a surgical professor. He was based in the East London. He taught students. He did pro bono work, gastroscopes. He contracted TB some years ago, occupationally acquired. And if you can imagine, a professor of his stature with all the best medical care eventually succumbed from it. So these are the kind of, giants in the industry that have fallen from occupationally acquired illnesses that we want to remember. We want to support their families, and we want to also, our call to action is to collaborate with 702 and people like you.
And that's why you are walking the talk with us on the 8th of November. You're walking for all these people that you want to memorialize, for all the people that your colleagues, their families, and everyone who gets left behind. All right, if anybody wants to know more information, we'll certainly put it up on our website. But you can also, of course, if you have a friend, a relative, or a colleague whose name you want added to that memorial, you can email info@healthcareheroes.co.za. info@healthcareheroes.co.za. Dr. Malebo and Nomsa, I really, really thank you both for taking the time to come into the studio today to share your story, Nomsa, so bravely. And Dr. Malebo, we'll see you virtually on the 8th of November as we walk the talk for all our heroes. Thank you for the incredible work you both are doing.
Current events, developing stories,
tough questions,
your voice making a difference.
This is Breakfast with Bongani Bingwa.